Right, welcome everybody to this month's Liverpool Dementia and Aging Research Forum. This July webinar will feature Dr. Bram de Boer from Maastricht University in the Netherlands. He's a researcher there looking specifically at long-term care and people living with dementia. And he's done a lot of research, particularly into COVID as well, with his research team at Maastricht. And so whilst you are listening to this webinar, if you are on social media, please use the hashtag Liverpool Dementia to kind of share your thoughts or any questions, for example. But also please feel free to post your questions throughout the talk in the Q&A box, and we will publish them and then we'll discuss them afterwards. So now Bram will give a talk for around 30 to 40 minutes, and then we have quite some time to do the Q&A. And now over to you, Bram. Welcome.
Yes, thank you. Hello, everyone. My name is Bram. I'm a researcher at Maastricht University, and I do a lot of research within the Living Lab of Aging and Long-Term Care in the southern part of the Netherlands. And this Living Lab is actually a collaboration between the university and University of Applied Sciences, but also vocational training institutes, and basically all long-term care organizations within our region. And as Clarissa already said, I do a lot of research in nursing home care for people with dementia in particular. And today I'm going to talk to you about monitoring the experiences of care home visiting during the pandemic in the Netherlands. And other research that I'm doing focuses on innovative nursing home care for people with dementia, such as dementia villages, but also green care farms for people with dementia, which is something that is developing quite quickly in the Netherlands. And because that is one of the topics, I want to start off with a picture of a cow who's basically trying to eat the grass on the other side of the fence. And that is quite illustrative also for the question, like, is the grass always greener on the other side? Because this is actually also what you see happening during the COVID-19 pandemic, is that we are constantly comparing countries. We are also in the Netherlands, and I think it might be the same in the UK as well, is that in the Netherlands, we are constantly wondering, okay, why aren't we doing things the same as, for instance, in Sweden, or why isn't our lockdown as strict as in Australia? But also when the vaccination started, okay, why aren't we going as quickly as, for instance, the UK or other countries? So this comparing of countries is quite illustrative also for the COVID-19 situation, and we will be doing that during this talk as well, comparing the UK with the Netherlands a bit at the end also. So when you look at the Netherlands, we have a population of 17.5 million people, and the proportion of older people is quite large, it's quite substantial, and the number of people of 65 and above and also 80 years and above is increasing rapidly. And we have more and more people living in care homes as well, which is quite similar to other countries, of course. And you might be familiar with these kind of maps of the UK as well, which is basically something that in the Netherlands, at least every day, we get via the news a new map of showing the infections of COVID-19 in the different regions of the Netherlands. And I prepared this talk last week or like 10 days ago, and actually I wanted to start off with quite a positive story about the COVID-19 situation in the Netherlands, because it was going quite all right, to be honest, and we had a good vibe going on, so to say. And so here you see this map where the lighter areas, so the gray areas, are areas in the Netherlands where no or almost no infections were happening. So things were, looking quite all right. However, things are moving along quickly, because actually like 2 weeks ago, the government said, well, because everything is going so well, we will remove all restrictions or almost all restrictions. And I think something similar is happening in the UK as well at the moment. So it's interesting. I'm very curious on what will happen, and I don't want to be negative, of course, but this is the map that we got yesterday. Which basically shows that, of course, the gray areas are almost all gone, which illustrates that the number of infections is increasing rapidly again, despite of quite a high rate of vaccinations already. But I will get to that in a minute. So I want to start with a short timeline of COVID-19 in the Netherlands, just to give you an idea, okay, what's happening or what has happened. And actually, it all started in February 2020 here, where we had our first COVID-19 case. And in March 2020, numbers started rising quite quickly, and we went into what the government called an intelligent lockdown, which was something different compared to other countries. So you could also call it a lockdown light version, because we were less restrictive as other countries. So one thing that did happen was that nursing homes or care homes were closed completely for visitors. However, other measures such as the wearing of mouth masks or not being able to get in contact with other people, or the restriction of group sizes and those kind of things, did not happen at that time yet in the Netherlands. And despite of this lockdown, we had a peak of our first wave in April, but then we started seeing that these measures were working, at least because we had quite an easy summer with what we call the 1.5 meter society, with a low number of cases between June and August. And after the summer, so after the holidays, you started seeing an increase in numbers again. And actually in October, we could say, okay, we are in a second wave at the moment. And then the government needed to be more restrictive. So we got a new lockdown, basically, which was much more restrictive than the first one. So in the second lockdown, we also had the curfew, so we were not able to go outside after a certain time, and also restaurants and bars and those kind of things were closed. And also the wearing of masks became obliged, which was not the case before that. I think we were one of the last countries to do that. So this is what happened last year. And then in January 2021, so at the beginning of this year, we started seeing the alpha variant more and more in the Netherlands as well. And again, it led to an increase in cases. Although we also started with the vaccinations in January, nevertheless, the third wave reached its peak at March 2021. So this is a bit of a timeline up until March. So what has happened, and what I just told you, you can also see that in the figure here. In total, we have around 18,000 reported COVID-19 deaths in total. And here you see the peak, so April, November, and then in March. And the decrease after March was largely linked to the starting of the vaccinations, which happened in January. And basically, I think the numbers are larger currently, but approximately we have 6 million people fully vaccinated and 4 million partly vaccinated. But I believe that at the current time, all adults, so all people older than 18 are able to have a first vaccine. And we are also now starting with the vaccinations of children between 12 and 18. So in terms of vaccination, I think we started a bit late, but the rate is quite all right at the moment. And as I said, we have quite a lot of people living in nursing homes. We have approximately 125,000 people living in a nursing home. And I checked last week, okay, how many cases did we have in nursing homes? And it was 2. So this means that the number of COVID-19 cases in the Netherlands is almost 0. And it's like that for quite a while already. So this was the positive story that I wanted to show you. And the thing is that we saw this decline in numbers going on. And this is what happened last week. So you see here that the figure is expanding a bit, and the number of cases increased really fast. So it has never increased this fast. What we had 500 cases 12 days ago, and now we have 8,000, 9,000 cases. So the numbers are increasing really rapidly. And what we do see is that the number of people who get COVID-19 are now people between the ages of 16 and 30, something like that. So a lot of young people are getting infected at the moment. So a lot can happen in a short period of time, and we're not done with COVID-19 yet, of course. So this was just to give you an overview, okay, what has happened in the Netherlands and what's going on. And today I want to talk to you also about this nursing home closure, which has happened last year in March, which was actually part of this first intelligent lockdown. One of the things that the government said, well, we should protect the most vulnerable people in our country, and those are the people living in these nursing homes. So therefore, we will close the nursing homes for visitation. And this was actually, one of the most restrictive measures that was taken. So it had, and the thoughts were also that this will have an enormous impact on residents. So residents were not able to see their family members at all. And this poses also a lot of dilemmas for staff, of course, because they were coming up with all of these creative alternatives, such as window visiting or separate container or area where people could visit. But still, it provides a serious challenge to the residents' autonomy, because people and residents were not able to decide themselves anymore whether they wanted to receive visitors, yes or no. And the thing is that at the time that these decisions were made, primary data was lacking, so we had no idea what is the impact of this kind of measures and what is it even possible to do it, and also what are the effects for families, staff, but also for the residents, of course. And what you actually saw was that after 2 months, so after approximately 8 weeks, the pressure on the government became really high, because there were so many voices saying, well, we should stop with this closing of the nursing homes. We should allow visitors again, because the effects on well-being are very impactful and are very negative as well. So after 2 months, the government started thinking about taking measures to cautiously allowing visitors again at care homes and nursing homes. So they started with a national pilot in 26 nursing homes, and the Ministry of Health, Welfare and Sport asked the Living Lab, but also other living labs in the Netherlands, for monitoring of this pilot, basically. And this started in May last year. And before reopening or cautiously reopening these nursing homes, they developed a guideline for allowing visitors. And this guideline was developed by people from the government, but also by other stakeholders in the field. So professional organizations for old age medicine, psychologists, nurses, but also client representative organizations were involved, and also the Alzheimer's Society. So a lot of stakeholders were involved in developing this guideline, which was not directive, not mandatory, because it was also possible to adjust the guideline based on local context. But at least they tried to set up a guideline based on input from all relevant stakeholders. The key points in this guideline for visitors was actually, well, some of these might sound quite straightforward, right? But you should imagine that this is at the beginning of the pandemic. We didn't know a lot, and we were coming from 2 months of closure. And what we said, or what they said, well, okay, in this guideline, you are allowed now to have one designated visitor, survivor is the show, one designated visitor allowed per resident. And basically, of course, people had to take personal hygiene measures at the entrance, and also agreements had to be made about the frequency and duration of visits. So that visitors are spread throughout the day and the week, so that not too many visitors come at the same time. There was the 1.5 meters distance, which was not only between visitors and family, but also from staff and other residents. So in general, these guidelines were started, and of course, visitors should be free from COVID-19 symptoms. And what was interesting was that at that time, visitors were obliged to wear a protective mouth mask for visiting residents who are difficult to instruct. So that means if people have dementia, then you were obliged to wear a protective mouth mask. But if you visited anyone else, so people without dementia, that was not necessarily required at that time. And for the organization, so not necessarily for the visitors, but for the organization, there were some key points as well. And basically, nursing homes were obliged to observe the regulations, to check for compliance, but also to make sure that there was sufficient protective equipment, and to follow the hygiene protocols and stuff like that. And there should be sufficient staffing and sufficient test capacity. So these were some points that were a part of this guideline. And then the question, of course, is like, okay, is it feasible to apply this guideline? And that was actually what was asked us as well to monitor, like how is the guideline applied in local context, and how is the compliance with this guideline? And lastly, but probably most importantly, what is the impact on well-being of this, of reopening basically, on residents, family, and nursing staff? So we started with this study with these 26 nursing homes, which were selected by the local health authorities to basically do this pilot to reopen as the first nursing homes in the country. And we used the mixed methods approach. So we had some surveys, we did telephone interviews, we asked for the local protocols for from each of the organizations. And yeah, this sounds a bit silly, but there was a WhatsApp group which was created actually by us as well, with stakeholders from all 26 nursing homes. So, so that they could exchange ideas and they could exchange questions and thoughts on how to organize this reopening. And we gathered data from that WhatsApp group as well to see, okay, what are they asking questions about, what is unclear, and how are they helping each other. So data was collected on the visits, on the context of the nursing home, but also on the application of the guidelines, the compliance with the protocols, and lastly, on the well-being of residents, family caregivers, and staff. After the first week, so this is like the first week of reopening, we saw that approximately 57% of residents received a visitor. So 57% of people who should receive a visitor from that time on received an actual visitor. So that meant that quite a lot of people did not, which basically indicated that arranging this whole visitation was not that easy. It was quite difficult. And we saw that only 6 locations managed to have 80% of residents receiving visits. And also some deviations from the guidelines occurred. For instance, there was one nursing home who had more than one designated visitor, not a survivor, but a designated visitor. And most visits were happening in a resident's own room, whereas some locations also had specifically designed rooms for the visits. And approximately the visits lasted for 45 minutes. So this is what happened in the first week. And looking at compliance, we saw some variation of the guidelines throughout these 26 nursing homes. So the main differences were related to the protective mouth mask. So from the 26, 11 actually said, well, the masks are for staff and visitors, whereas others say, well, if you are visiting a resident with dementia, then you should wear a mask, but otherwise you should not. So there was still some debate on this wearing of masks, which was also not only in nursing homes, but it was actually in a national discussion, which took quite a lot of time in the Netherlands. And other things that we saw was also that there were differences regarding the supervision of these visits, because 10 nursing homes decided not to supervise the visits because they said, well, it's time that people finally can spend together and they should be able to do that by themselves. In general, respondents indicated that visitors and staff were compliant with the local protocol. So that's what we got from the survey. But in practice, we did a lot of observations and we saw that still some deviations were observed. So people not wearing the mask or physical contact happened during the visit, which of course was not completely according to the guidelines. Looking at barriers and facilitators to reopen, we saw that, and a very important one was that there was a significant increase in workload for staff, because they were, of course, responsible for preparing and organizing these visits and also for putting these measures into practice. And some nursing homes actually designated specific staff for these tasks, whereas others did not. And another important part is also that nursing homes were required to do their own evaluation of the visits as well. So they should be able to report of how did they organize it, how did it go, etc. And that also, again, increases the workload, of course, for staff, because they need to do that evaluation as well. Another thing which was a barrier was the scarcity of PPE, so the personal protective mask in this case, which was, of course, not only in the Netherlands, but a worldwide issue, I guess, because especially in nursing homes in the Netherlands, there was not sufficient protective equipment available. Looking at the impact of well-being, we see that all nursing homes were positive about the visit. So it doesn't really matter who you talk to. All of them say, well, we now see that this closure of nursing homes was a bad idea if you look at the well-being, because the visits have a positive influence. And here you see some quotes, for instance, drinking a cup of coffee together, being together in the same space without a screen in between. It seems like a small step, but it feels as a giant emotional one. And these kind of quotes we gathered a lot, and it just shows how impactful, or how much impact the closure of nursing homes had on the well-being. And also being able to visit again was a very emotional process. So looking at family members and residents, as I said, they were very emotional when seeing each other. What was interesting, that even though they were very positive, immediately in that first week, people also started indicating things that they were missing. So they said, well, the physical contact with each other, isn't it possible to get that in a way, because that was being missed a lot, but also the opportunity to go outside, for instance, that was missed a lot. And here you see one more quote, which shows how emotional it can be. A manager told us, well, it was an emotional reunion. The mister did not recognize his son, as they had not seen each other for 10 weeks. He was crying and could not understand how he could forget about his son. And for the son, this was difficult too. So this again shows how emotional, what an emotional process it could be when you got to see your father or mother again after 10 weeks. Of course, one question that came up was, okay, what does this mean for COVID-19 infections? And what we saw in those 26 nursing homes, that 3 weeks after visitors were allowed, no new COVID infections were reported in these nursing homes. And in comparison, there were over 700 new cases reported in other nursing homes, which were closed for visitors. So one of the conclusions was that, okay, visitation is not necessarily contributing to the number of infections in the nursing homes. And in conclusion, based on this first small pilot, which was actually the first study to report on this compliance and experiences, you see that this national guideline helped, but it was applied differently in the local context, and that compliance was sufficient to good in these first 3 weeks. And people were very positive about their experiences, and the added value was widely recognized. And these results were actually shared with the Ministry of Health, Welfare and Sports, and based on our research, but also research from other living labs, it was decided that as of May 25th, all nursing homes should be applying this national guideline. So 3 weeks, 4 weeks later, all nursing homes which were able should provide this guideline, which actually meant that nursing homes started opening up again. And what was asked from us was, okay, can you continue this monitoring? Because we started with this pilot of 26 nursing homes, and we continued with a survey among these 26 and an additional 50 to see, okay, how are the experiences when you actually do this nationally? And the results from this measurement on a national scale, well, actually were quite similar to the results that I just talked about from this pilot. So again, you see that as time progresses, more and more residents were receiving visitors. And this first week, so the first weeks were very emotional, and respondents really indicated the negative impact of a ban for visitors, because they were talking about issues such as loneliness and effects on functioning of residents as well. And the interesting thing is that here we are a month further in time, and then you see that what we actually already saw in the pilot was becoming more and more. So family was requesting expansion of regulations. So they were asking to allow more than one visitor, more flexibility in time and frequency of the visits, and also the possibility to go outside, which was not allowed still. On the other hand, staff was experiencing anxiety for a COVID-19 outbreak still, and the concerns of staff became larger actually, because they noticed, okay, for a long-term implementation of these guidelines, it really provides a high workload. And of course, also nursing homes were struggling, because if staff got complaints or symptoms, they needed to get tested, they were in quarantine, etc., which did not really help in terms of the workload, of course. Another thing which was noticed in this follow-up was that even though there was a national guideline, different regulations among nursing homes in a similar region existed, which was very difficult for family caregivers to understand. So for instance, why is it in that nursing home allowed to visit without a mouth mask, whereas I need to wear it? Or why can they visit more than 1 time a week and I can just visit 1 time? You know, those kind of things came up quite a lot in this follow-up as well. So this was actually, these results are published. So if you're interested, you can have a look at that as well. And this is all based on research that was done last year. And the situation changed after this first wave. So what we saw was that the national guidelines became less restrictive. And for instance, more than 1 designated visitor for all residents was allowed. People could walk outside again. And since of July, nursing homes are open as usual, with, of course, the existing restrictions, which are nationally, but there were no separate rules or restrictions for nursing homes anymore. And some of the lessons that the government actually put out there was that, okay, perhaps we were too restrictive for a too long period. And also, it's good to check for the impact on well-being, such as loneliness and those kind of things. And another question which was still part of the debate was, why were nursing homes lagging behind on the PPE, which was, yes, actually a question which remained unanswered, I think. But you saw that the focus was just on providing hospitals with this protective equipment. But it did, like these first studies did, contribute to the debate of infection prevention versus quality of life, especially in these nursing homes where people live who, like on average in the Netherlands, people who move to a nursing home live there for 8 months. And after that, they pass away. So it means that if you're not allowed to have visitors for 2 months, that can have a real impact on your life. So the question then becomes, well, what's more important, infection prevention or quality of life? So that was all last year, and this year we started vaccinating, of course, and then we kept continuing monitoring this, these visits at nursing homes, but also just the regular COVID-19 situation in nursing homes. And one of the questions that was also raised, okay, now we are vaccinated, and what does that mean? And here you see, it's a Dutch figure, but it's an opening plan of the government, which basically said, well, these vaccinations are the key to more freedom. And nursing homes are actually the front runners in terms of vaccination, because they were the first people to get vaccinated. Staff was the first to get vaccinated. So what you would then expect, and which was also actually told by the government, is that in these nursing homes, you would expect the first, removal of rules to occur. And we actually checked whether that was the case. So we had a new measurement in March this year where we actually asked, okay, what's the impact of vaccinating nursing home residents and nursing staff on the daily life in Dutch nursing homes? So we had another survey in these participating nursing homes, so these 76 nursing homes, and we asked on the infections, impact of COVID-19, but also on the existing restrictions, the use of tests, vaccinations, and the impact of vaccinations. And what we saw was that in terms of vaccinations in March, we saw that 77% of residents were fully vaccinated and 65% of nursing staff were fully vaccinated. And this was actually in March, and the estimations at the moment are that almost all residents and staff are fully vaccinated. Just before my talk, I checked the willingness to get vaccinated in the Netherlands in general, and it showed that 95% of people are willing to get vaccinated, which is, I think, really a high number. In March, that was not the case yet, because we did see some reasons to refuse vaccination. I realize now that the figure it's in Dutch, by the way, I apologize, but I guess it's also a bit too small to understand. But reasons to refuse vaccination, actually what we saw was that for residents, it was very often the case that they felt to be too vulnerable to get vaccinated because of the side effects that it could have. In terms of staff, we saw that there was a lot of fear for side effects, and people just didn't know enough about the long-term consequences, for instance. And what we also saw in staff, nursing staff, that, well, the majority of nursing staff is female, and there were a lot of concerns about, okay, pregnancy-related reasons, like what does this mean, which was mentioned quite often. But in general, and that's what we can see now, it did not lead to a lot of people refusing vaccination because, as I said, estimations are that now almost all nursing staff is vaccinated. And then we have these vaccinations occurring in nursing homes, and then the question is, okay, what's the impact of policy on nursing homes? And here again, the figure is in Dutch, but what you see is that the blue bars are actually regulations which were becoming less restrictive, whereas the orange ones means that nothing happened to the restrictions, so that the restrictions still stayed in place. For instance, we asked, okay, is it now that people are vaccinated, allowed again for residents to have contact with each other, or are activity areas open again, or are there more, is there more possible if you are vaccinated? Those kind of questions. And what we just saw was that nursing homes kept answering no, 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 that's not happening yet. And the same applies for the impact on interactions between or interactions of nursing home residents, because we also, like in the newspapers here, were messages, okay, nursing home residents are allowed to hug their family members again, and those kind of things. And we actually asked those kind of questions. Well, is that the case? Or is it true that residents do not have to, or that visitors do not have to wear a mask anymore? Or are visitors allowed to eat again together with the residents, and those kind of questions? And still nursing homes kept answering no, 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 we're not doing that yet. So the interesting thing here is that moving away from restrictions does not happen automatically. So we saw, as I said, like nursing homes were the front runners in vaccinations. However, still not many restrictions were removed. So they were very cautious in removing these restrictions. And the interesting thing here is that these vaccinations are presented as the key to freedom. However, nursing homes were still waiting for national rules to change. So they were really, they required guidance also in letting go of the regulations, whereas the government actually said, well, if you are like 80% vaccinated in your nursing home, you can go ahead and not follow all the rules anymore. Eventually, also the national rules started changing, and currently the situation in nursing homes is almost back to normal. But it was really clear that nursing homes did not do this on their own. So I think this is everything I can talk about in terms of our research in the Dutch setting. And I want to end with a small comparison of the Netherlands with the United Kingdom, because of course, care homes in both countries are hit very hard by COVID-19. And I do believe that there's a difference in government guidance because, and correct me if I'm wrong, but I understood that in the UK, it was really individual care home responsibility to make decisions to ease or tighten visiting rules. Whereas in the Netherlands, there was a bit more guidance, I guess, from a central government. So what we did actually is we did a combined study together with colleagues from Liverpool University as well, like to combine qualitative data gathered during the lockdown and the reopening period in both the UK and the Netherlands. And the aim was to explore and compare the experiences between countries, basically. And what we then saw was that 4 themes emerged in that qualitative data. And the first one was related to the different types of contact during the lockdown. So we saw that in both countries, there were a lot of these creative solutions, such as window visits or video calling and those kind of things. And the experiences with that were also quite diverse. So we saw that some people really appreciated that, whereas, for instance, for people with dementia, that was quite difficult sometimes and actually led to more agitation because people did not really understand what was happening and why that was happening. What we also saw in terms of these different types of contact was that in the UK, the rules were more diverse. So as I said, in the Netherlands, we had some cases where within a region there were different rules. And I think that in the UK, that was even more so the case, which can be a cause of frustration for family members, especially. So that's something that we did find. Another theme, which is actually also in line with what we saw in the Dutch context, was that this closing of nursing homes can really lead to a deterioration of resident health and well-being. And we actually read a lot of stories and had a lot of talks on how residents, or especially people with dementia, deteriorated in terms of their cognitive functioning because they were not getting stimulation. They were not stimulated for 8, 9, 10 weeks or even longer, which can, of course, have an impact. And the third theme was the emotional distress of both visitors and residents. And I think I've said enough about this, but I did a lot of interviews with people who visited their husband or their wife or their mother or father after 8 weeks of not seeing them. And I did the interviews immediately after their first visit. And I actually got a lot of people in front of me who were just crying because of how emotional that process was. And the last theme was the compliance to the guidelines and regulations, which, as I said, was in general quite all right. But when you start observing people during their visits, you actually see that, and I think that's happening all over the place, that not only in nursing homes, but people make their own judgment. And if they think, well, it's fine to give a hug, or it's fine to touch each other, or to give each other a kiss, or those kind of things, then they will do that anyway. And that was actually what we also saw during the reopening of the nursing homes. So as a like sort of a discussion or reflection, we see that this lack of government guidance has left care homes across the UK, but also in other countries, without clear guidance about how to manage this infection risk, as well as manage residents' well-being. And the difference between countries was that in the Netherlands, we had quite quickly implemented this blanket guidance on care home visitation, enabling a faster and smoother transition. However, regardless of that, we still see a lot of diversity across the country, also in the Netherlands. So sometimes it's framed a bit as I started, like the grass is always greener on the other side. I don't know whether that's actually the case. I think the national guidance was helpful, but still in terms of what that means in practice, there is a lot of diversity in that. And that was basically what I wanted to talk to you about today. So thank you for your attention. And I'm not sure if there are any questions or remarks.
Thank you so much, Bram. That was really interesting. I mean, I've read the paper that is out, but it's always nice to hear it from the person who's been conducting the research, placing it into the wider context. And I think for mostly the UK audience here, it was interesting as well, because it really seems like the Netherlands has been the first, maybe only country that has implemented these guidances on safe visitation in care homes, to learn from that, hopefully. So there have been quite a few questions, but to the audience again, please pop your questions in the Q&A and we'll pick them up. But I think one thing I just wanted to pick up first, to kind of show the stark contrast, you were referring to a few times the really emotional experiences of family members that were visiting and finally seeing their loved ones in the care home again after, say, 8 to 10 weeks in the Netherlands. And for us here, it's been months, and even then it's just so emotional, and it's lovely to hear that it's been possible in the Netherlands, so much shorter. But it just makes us think, I think, about all those months that families haven't been able to see their loved ones in the UK.
Yeah, I can imagine. And the thing is, we noticed the same in the Netherlands at first. Like, we have this outbreak management team, which is basically a team of people advising the government on what to do in terms of guidelines and regulations. And the focus was really on infection prevention, and it was very much medically oriented. And as time went along, also other disciplines such as psychologists became member also of this outbreak management team, stating the other side of the story, saying, okay, you have, as I said, you have infection control on the one hand, but quality of life, especially for these people in their later stages of life, and we need to consider that as well. And luckily that landed at the government as well, but still it's sometimes cause for debate, because you see that people from a more medical background don't necessarily agree, because of course every risk you take is also a risk of spreading of the virus again. But at the same time, sometimes you need to accept those risks. And I think a lot of family members and also residents wanted to accept that risk.
Yeah, and it was interesting to hear in your last few slides as well that there was some guidance from the government saying if 80%, did you say 80% is vaccinated, you're allowed to open, but the sheer reluctance of care homes to reopen again for visits.
Yeah. And so they actually said, well, if 80% of residents and staff is vaccinated, then you are allowed to open up again and to remove all the rules. But no one did that, or not a lot of nursing homes did that, because they were so afraid of something happening, and then they are responsible, and that's the thing. And then as soon as the government said, well, okay, now it's officially by law, you are allowed again, then all of a sudden, all of them opened again. And I'm doing a lot of research on these innovative nursing home concepts, which really try to provide this person-centered care, etc. And I saw that managers in those kind of facilities actually already were not following the guidelines before the government actually changed the rules. So you did see it happening in some of the nursing homes, but most of them were just because they're so afraid, and I also think because of they are still very medically oriented or traditionally oriented, that they decided not to remove the guidelines before the government officially made it a rule or law. Yeah.
Mm-hmm. So we've got a few questions here. I think the first one has already been answered in your subsequent slides on uptake of vaccination, which was interesting to see as well. You saying it was a bit limited at first in staff, but then it increased afterwards. Mm-hmm. So we've got a question from Martin Reagan on after wider adoption of the national policy on nursing home visits, was there any increase in cases of COVID-19 among residents or nursing home staff?
So I showed, like, after the pilot, there was not, and I believe that in terms of the spread of infections nationally after the reopening, I don't think there was a large increase in numbers, like not disproportionately large compared to the rest of the country or other situations. Of course, you had an increase in some of the nursing homes or an outbreak in some of the nursing homes, but I don't think there was a, how do you say that, like a disproportional increase in numbers in these nursing homes. No. The thing is, we have different living labs in the Netherlands, and we were more focused on the impact on well-being and the compliance to the rules, whereas other living labs focus more on the actual infections. So I could check, but I don't think so. No.
Yeah. Okay. And the comment from Chris as well, very interesting. I think she's referring specifically to the UK focus. There's been a lot of frustration because of that variation between approaches in different care homes and so many changes in guidance, if there was any, and just the lack of clarity. Was that something that came out with you? I mean, I have been involved in our comparison, but maybe for the audience, that communication, how was the communication of guidance?
Yeah, I think that's so. First of all, like the variation between nursing homes within a region or something, that is cause for frustration, which is very like, of course, that's cause for frustration because people don't understand. And then it's very important that there is good communication on why certain choices are made, because sometimes nursing home have perfectly good reasons to be more restrictive than others, for instance. Or to be less restrictive, because that's also sometimes reason to be frustrated. Like, why are you allowing so much in this nursing home? Isn't that dangerous? You know, those kind of questions also arise. And what we saw in the Netherlands was that in general, the communication to family members and other stakeholders as well was continuous. So there was a continuous communication from actually May 11th. So when the pilot started. Yeah, and still that's going on because you just constantly need to communicate, okay, what are the rules? Why are the rules in place? And then family, I think in general, is also on board and they can follow that line of reasoning.
Mm-hmm. So, yeah, I think that's one of the key messages that seems to take away messages from this pandemic, isn't it? In either country, there needs to be clear channels of communication. One question from Alison about the PPE that I picked up on that as well. So what was the rationale for why masks were only for visitors of residents with, for example, dementia?
Yeah, that's a very good question. The thing is, the whole discussion on the masks, as I said, I think we were one of the last countries who actually made wearing a mask obligatory compared to other countries. And that was not only in nursing homes, but in general. So we were not wearing masks for a long period of time because actually the National Institute for Public Health and the environment here in the Netherlands was really reluctant on accepting that wearing mask has an effect, because they were saying, okay, wearing the mask is kind of like a, how do you say that? A fake way of feeling protected. That's not good English, I think, but they that's how they put it for a very long time. So the government actually did not make it a rule for a very long time. And then eventually, when the numbers started increasing here again in October, they said, well, because we're now moving away from the intelligent lockdown into a full lockdown, we will also use the wearing of masks. And as soon as that happened, wearing a mask was actually obligatory by everyone. But the reopening of nursing homes was before that time. So no one was wearing a mask. And then they said, okay, let's only wear a mask when you are visiting people with dementia because they cannot keep their distance. So the National Institute basically told everyone, as long as you can keep 1.5 meters distance, wearing a mask is not of added value. And they kept saying that for quite a long time. They're not saying that anymore.
Interesting.
Yeah.
We've got a question from Neil Chatborn, considering outdoor meetings. So considering meeting outside was encouraged for the general public, at least in the UK. Do you know why outdoor space or walking outdoors was problematic for nursing homes in the Netherlands?
Well, I think it was just a matter of not knowing at that time what was possible and what was in terms of risks dangerous or not. So I think after the 2 months, so after the pilot, as I said, they started also changing those regulations so that people were allowed to go outside. But really at the beginning, we were very restrictive in these nursing homes. So people did not see anyone and they could also not go outside, which is, yeah, you can now, like in hindsight, think about, okay, why would you do that? But at that time, yeah, that was just the decision that was made. And of course, in hindsight, yeah, well, not a very good one, because outside it would be perfectly possible to have these visits, of course.
Yeah, and interesting as well that you said that most visits that were enabled in the Netherlands seem to take place in their own room, which wasn't the case in the UK at all.
Okay, yeah, no, and that's what they said here, well, you should make sure that the contact is only between the visitor and the resident that they're visiting, and all other contact should be avoided. So therefore, you saw that a lot of nursing homes did it in the private rooms of the nursing home residents. So and there were like these walking routes, etc. So just to make sure that there are no other contacts.
Okay, we've got 2 more questions, unless anyone else is posting any. So one from Christina. Do you know of any mental health and well-being support in place for residents and for nursing home staff in the Netherlands?
Yeah, so I don't know whether that's a national organized thing, but I know that in the nursing home organizations within the Living Lab where I work, also during the COVID-19 peaks and during the lockdown, psychologists also were there for staff if they needed to talk to, and also for instance, residents or visitors, not only psychologists, but also, I'm looking for the English term. I don't know it. Like someone from the church often comes to talk to people, but I don't know the English term for that.
Like spiritual support.
Spiritual guidance or something, yeah. And that's also quite common in many nursing home organizations here as well, especially for the residents, because they can relate to that. Yeah.
Oh,
so there are some safety nets in place. That's the case. Yes.
That's great. I don't think we picked up on that in the UK. It seemed to be much more limited and just a lot of burnout for staff as well, what we've noticed, unfortunately. But that's really, again, another learning that staff and residents and family members really need to be psychologically supported well.
I think so. The interesting thing is, though, that I talked to a lot of managers in these nursing homes, and what they then also told us was that staff not necessarily uses the support of psychologists and stuff, but more often want to talk to the manager and other staff members just to share their experiences rather than seeking actual professional help. At least during the interviews, that was mentioned quite often.
Yeah, okay. And the final question from Kate, wondering about, we've seen your numbers in the Netherlands going up drastically in the past 2 weeks, as you've shown in that diagram, whether there's some sort of essential caregiver system in place in case the Netherlands go back into a full lockdown. Will there always be an essential visitor now to someone in a care home, or?
Okay. Yeah. So actually, I think, you never know for sure, of course. But I think if the situation deteriorates so much that it's necessary again to be restrictive in nursing homes, we will eventually move back to this situation where there is one designated visitor or something. But in general, and also by law now, it's not allowed to close nursing homes anymore, even if the situation deteriorates. So visitors should always be allowed in nursing homes. And that's, I also think, an interesting thing, which is not happening in other countries, because still nursing homes could be closed quite, how do you say that, from one day on another. Whereas that's not happening. At least the expectation is that that will not happen again in the Netherlands. But yeah, you never know for sure, depending on how the situation goes. Yeah.
That's really interesting. I think that final point to just, there seem to be more, it seems to be ingrained in law better, the support and looking after residents and I suppose families as well than in the UK. So that's why it's really interesting to have you shared your research here and discussed it. So some interesting learning. So that's been all the questions. Thank you so much, Bram.
Thank you.
If you could just click to yes, super, thank you. So just to make everyone aware, our next webinar will take place on the 22nd of September from 1 till 2 o'clock. And we'll have Dr. Catherine Talbot from Bournemouth University, and she will share and discuss her research into dementia and digital technologies during the COVID-19 pandemic. So she's published some research on that already as well. and I've shared the Eventbrite link in the Q&A box as well. So I hope you've all enjoyed this webinar, and you can always look it back on YouTube afterwards as well. But thank you very much, Bram.
Thank you.
Thank you. Bye, everyone.